presence and engagement. Your dedication to learning, sharing, and advocating for those affected by lupus is invaluable and a testament to the strength of our community. Together, let us make today a day of meaningful connections and impactful learning as we continue to empower lives and inspire hope. Thank you.
Thank you, Dr. Desiree Tollereid. You know, somehow I feel, listening to you, that as the late Oxford professor C.S. Lewis said, what's in front of us is far greater than what's behind us. And somehow I feel that the stewardship that you have displayed, and President Emeritus Dr. Carol DeCooler, and all the volunteers and the board members over the last 40 years, I think what's in front of us will be far greater, and that's what's behind us. At this time, I will just invite Dr. Carol DeCooler to come forward to introduce Professor Nigel Harris. Thank you. Mm-hmm.
Good morning, everybody. It's an honor and a pleasure to be here speaking in the opening section of this symposium. And for the 35th symposium, and this is a long time, and nothing seems to stop us having symposia. Nothing can stop it, not the lack of funding, not the weather. I remember that in the 80s, we actually had a symposium in the Windham, and a storm hit us the day before or the night before, and some trees were down, and the whole hotel was wet and so, but we still proceeded to have our symposium, so nothing can stop us. And if you look at all the recurrent events, we are much better than Reggae Salute, maybe even Reggae Sunsplash, because not too many events have 35 events in a row. Not too many people can say so. Anyway, I'm here really to introduce Professor Nigel Harris, who I know when we were working together in the rheumatology clinic. And apart from looking after lupus and rheumatoid arthritis patients, we tried to do a little research, which was a bit amateuristic, but then Professor Harris went on to real people, to like in the UK, St. Thomas Hospital, with Dr. Graham Hughes, and then got involved in and described the antiphospholipid antibody syndrome, which we now have developed and is very much a part of lupus. He went on, of course, in exponentially ascending career of getting professor in Louisville, dean in Atlanta, and of course, vice chancellor of this university, and probably prime minister of St. Lucia very soon. Although to be a politician, you have to have a big pocket where you can hide your treasures. And he will have to have a tailor, because he never went for the big pocket. So maybe we could ask a politician to advise on the right tailor to have the big pocket. Without any ado, I would like Professor Harris to open this symposium.
Well, thank you for that kind introduction. I will speak about Carl a little later on. But I want to start by congratulating all members of the Lupus Foundation who really have had these symposia over so many years. This is the 36th. And of course, has existed for 40 years. And I think, as Carl has said, anything that can last that long, must be meaningful. And it took, obviously, devoted attention and work to reach this far. My experience over the last few decades, and in more than one country, has convinced me that lupus support groups are a vital resource in the management of patients with what is a chronic and often medically challenging disorder. I believe that every doctor managing a large number of SLE patients absolutely requires partnership with a lupus support group. I chose as my topic today, journeying with lupus over half a century, and of course, one. And preparing this talk has enabled me to think of those 50 years and learning, and still learning about lupus. My first interaction with patients with systemic lupus occurred in the mid-70s when I was a student at the University of Pennsylvania. I got interested in the disorder because I was interested in immunology and autoimmune diseases. And of course, lupus would fit as one of those diseases in that spectrum. I should tell you that the University of Pennsylvania was the first medical school in America, and it apparently was funded by a grant from Jamaican planters. We have always thought of, can we go and reclaim some of that money? But my first real interaction with lupus patients occurred when I came to the University of the West Indies at Mona as an intern and a resident. So I finished in the US and came here. And as I remember it in those days, and this is the late 70s, on any one day, you could find at least one or two lupus patients in the ward. I never believed it could be that, common and frequent. And most of those patients had kidney disease, but quite a few had neuropsychiatric disorders, and it's very relevant to today's talk. I used to say as a resident, if I was walking onto the ward and I heard a young woman with a psychotic behavior episode, it was lupus until proven otherwise. It really was quite remarkable, quite severe. And it's in Jamaica that I first learned it. One of the signal events of my residency was at the end of the time I'd finished as a resident is Dr. Karl de Köhler. He was the sole rheumatologist in Jamaica at the time, and for whatever reason, he invited me to come to work with him managing patients with rheumatologic disorders. I'm glad I said yes. And what that taught me was I was astounded by the large number of lupus patients in our clinic, many of whom I came to know very well. What the experience taught me was, although I saw a number of patients with SLE in the wards, there were far larger numbers of patients outside of the hospital who were living productive lives. True, those lives were not without health challenges, but with appropriate management, a significant number of SLE patients proved to be able parents, they were able partners, they were useful workers, and productive citizens. One of the things I liked about working with Carl is that he always had ideas. And one, I remember famously, some lupus patients told us that by drinking yeast tea, that they felt better. So Carl said, well, let's try it. And so I spent a long time. We would be concocting yeast tea in my home. It was a sugar water, we put yeast in it, the yeast would grow, and and then I'd strain it off, and we'd have the yeast, and we gave it to patients who agreed to take the yeast tea. Now, I don't know how well that worked, but I enjoyed drinking the yeast tea myself. It was quite a thing, but Charles really, really was an inspiring and inspired figure and made such a difference here. In 1983, I went to London to work as a rheumatology fellow with Graham Hughes. And Dr. Hughes was considered at the time to be the leading authority in Britain in systemic lupus. Colleagues joked that a patient did not have lupus until they saw Graham Hughes. What was important is that he had a large population of SLE patients in their hundreds. And thanks to that, we were able to see and identify a subset of patients with what became known as the antiphospholipid syndrome. So, you have to have sufficient numbers of people to do research, and it was there that we developed the anti-cardiolipin test and so on, because we had enough people. It was in London that I first became in touch with the Lupus Foundation. They were a vibrant group. Graham Hughes worked with them, and they provided educational materials and other forms of social support for lupus patients. They also raised funds for research. One of my cherished memories in London, while doing research in the antiphospholipid syndrome, was that for 6 months I had no salary. I'd lost my grant, I had no money. And happily, it was the Lupus Foundation that came to my rescue and provided me with some support during that period of time. In case you wondered how did I survive, I was a father with a wife, 3 children, one of whom is here. And, but happily my wife was a senior house officer. She did medicine in London, and so she provided a family support for me. The Lupus Foundation in London garnered a lot of support, a lot of public support, as you're doing here. And on one memorable occasion, while I was there, they organized a visit by the then Princess Diana to our laboratory. And it was quite a visit. It made a lot of headlines. And of course, our group managed to get some very iconic pictures with the princess, which I still have. In the mid-1980s, we moved to Louisville, Kentucky. And I worked there for a period of 8 years. And I became very close to the Lupus Foundation in Kentucky. What it ensured is that I could manage to attract a large number of lupus patients, as well as patients with the antiphospholipid syndrome, and the same effect that they had. You know, they were really important in educating patients, the public, about SLE. And then in the mid-1990s, I moved again to Atlanta, Georgia, where again, I developed links with the foundation, and in fact, was involved in a number of events like this. I recall that on one occasion, they organized a public event to which I was invited to speak. To my horror, the keynote speaker was someone who'd been the governor of Georgia 20 years previously, in the 1960s. He was famous and got elected because he was a pro-segregation governor. And in fact, he became famous because he was blocking a young black man from coming to his restaurant. So I said to them, there's no way I'm going to speak with a man like that. Anyway, they said that he had reformed over the 20 years. And I acquiesced and indeed met the man. And of course, he was no longer formidable. And apparently his views had reformed. But the point is, there are all sorts of experiences one has had. So over 25 years, I have worked and met people in Lupus Foundation in the UK, Kentucky, Georgia, and I've been in touch with Jamaica, and I've learned so much valuable from working with them. I assert that my links with lupus support groups have expanded my knowledge about medicine and the care of patients in ways that medical textbooks alone could not do. You know, some of the things that we are inadequate, I think, as doctors, is how do you manage the whole patient holistically? And doctors and healthcare providers don't have the time to sit down with patients and really deal with all the issues that they have. One must bear in mind that SLE affects women primarily in their childbearing years. These women are at the stage of life where they must deal with so many issues. So many modern women work and must contend with the demands not only of full-time employment, but they often bear the major responsibility for managing the household. They must support their partners and their children. Their pregnancies can be very complicated. Lupus support groups, therefore, help in so many ways. They may provide advice that patients can understand about how to use their medications, some of which are quite potent. Corticosteroids, cyclophosphamide, they're medications that could be very potent. And so they have to be understood and used correctly. They help patients understand the side effects of the drugs. Some patients have disfiguring skin and scalp lesions and must turn to support groups to provide advice about appropriate use of cosmetics and hair management. So many patients have periods of depression and hopelessness, often feel very fatigued. People forget that fatigue is a part of lupus that is often ignored. Patients have difficulties just coping with everyday challenges of life. Their ability to turn to get support from others like them, traveling the same road, can make a huge difference. And you can't ignore too the public educational value that lupus support groups provide, and this symposium has been one of them. Lupus can be a very difficult diagnosis to make, and this is where education may be important, because a patient may see a number of doctors who just miss that diagnosis because it's like other diseases. And so, you know, from people learning and hearing about it, eventually they can, you know, get the appropriate support. As I said at the start of my group, I think every doctor managing patients with systemic lupus, they need to have a lupus support group, because the sort of assistance this provides, no doctor, you know, on their own can do. I want to applaud the work done by the Lupus Foundation. The patients, the doctors, other healthcare providers. I mean, again, I want to shout out Carl Couler, because I know he would have been the one, but you know, the more current generation, Dr. Stacey Davis, Dr. Tuller Reed, you know, it's a new generation, and applaud them for taking on the working with patients to keep this foundation vibrant. In closing, let me thank you for inviting me to speak. It certainly enabled me to reflect on my years treating lupus patients and work with lupus foundations. Not only in medical years, but during those 8 years in Jamaica, I just loved coming to Jamaica. It was so special, and we have very, very many happy memories. I should add that one of the happiest moments in the early 80s in Jamaica was we welcomed the birth of our second child and our first daughter, Tamia. And she's now grown up and sort of agreed to come with me. We had to drive from the North Coast at 6 o'clock this morning, so she kept me alive. But Tamia happily, like her parents, decided to do medicine, and is a dermatologist and a bench scientist at the University of Texas in Dallas. Again, thank you so very much for inviting me, and I hope there'll be many, many more symposia like this.
Thank you.